Hi, this is Philip Ador, founder of NCLEX RN 45-Day Challenge. In this video, I'm going to be talking about breast cancer. Breast cancer or breast carcinoma is an uncontrolled growth of the epithelial cells within the breast. It's the second most common cancer in women, but can also on rare occasions affect men as well. Breast cancer is also the second leading cause of cancer death in the women after the lung cancer. This is largely due to the fact that oftentimes breast cancers don't cause any pain or discomfort until they spread to the nearby tissues. The breasts are the milk-producing glands that sits on the chest wall on either side of the breastbone. They lie on top of the ribs, in the pectoral muscles, and they're divided into three main parts. The glandular tissues that makes the milk is made out about of 15 to 20 lobules. Inside each of these is a bunch of grape-like structures called the alveoli, which are the modified sweat glands rendered by the basement membrane made largely of the collagen. Zooming in on the alveoli, there are a layer of alveolar cells that secrete breast milk into the lumen, which is the space in the center of the gland. Wrapping around the alveolus are the special myoepithelial cells that squeeze down and push the milk out of the lumen of the alveolus down the lactiferous ducts and out of the pores of the nipples. Now, surrounding the glandular tissues is the stoma, which contains adipose or fat tissues. And this makes up of the majority of the breast. Suspensory ligaments called Cooper's ligaments run through the stoma and help keep it in the place. These inner ligaments attach to the inner surface of the breast on one end and the pectoral muscles on the other. Just beneath the skin covering of the breast, there's a network of tiny lymphatic vessels that drain into the lymph, which is fluid-containing cellular waste products and white blood cells. These lymphatic vessels mainly drain into the group of lymph nodes in the axillary or the armpit. Now, the cells of the glandular tissues have receptors for certain hormones, like estrogens and progesterones, which are released by the ovaries, and the prolactin, which is released by the pituitary gland. This stimulates the alveolar cells to divide an increasing number, which makes the lobules enlarge. Without these hormones, the glandular cells, particularly the alveolar cells, can survive and undergo apoptosis, which is programmed to self-death. For example, after menopause, estrogen production stops, which leads to the death of the alveolar cells. And over time, that breast tissues gets replaced by fat. During the master cycle, there's an increased secretions of the estrogens and progesterones from one of the ovaries. And right after menstruations, that secretions decreases. As a result, during every menstrual cycle, the alveolar cells undergo divisions and apoptosis. That's why there's an increased risk of breast cancers with things that increases the number of the menstrual cycles. Like early age of menarche, which is the first menstrual bleeding, and the late age of menopause. Similarly, medications containing estrogens also increase the risk of breast cancers. There are also other environmental risk factors, such as ionizing radiations, like the chest x-rays and CT scans. On the flip side, some things that are associated with the decreased risk of breast cancer include early pregnancy and a longer time of breastfeeding. Breast cancer is also linked to specific mutations in tumor suppressor genes such as breast cancers genes or BRCA1 and BRCA2 and TP53, which normally slow down the cell divisions or make cells die if they divide uncontrollably. Mutations in the BRCA1 or BRCA2 are both autosomal dominant mutations which can be inherited and cause familial breast cancer. In addition to breast cancer, they also cause an increased risk of ovarian cancer. Some breast cancers also have the mutations in the ERBB2 gene that increases the human epidermal growth factors receptors to 2 or HER2, which when activated promotes the growth of cells in the males. Breast cancer is usually caused by inherited mutations in the BRCA1 and 2 genes. This tumor, also called an in situ carcinoma, is essentially localized within the basement membrane of the alveolar and can be of two types. The first type is called ductal carcinoma in situ or the DCIS, and that's where the tumor cells grow, from the walls of the ducts into the lumen. If left untreated, the DCIS over time can cross the basement membrane to become the invasive ductal carcinoma. Also, a cancer cells from the DCIS can migrate along the lactiferous ducts and into the pore onto the skin over the nipple. This is called the Paget's disease of the nipple. These cancer cells release a substance called mobility factors, which helps them break into and settle in between the squamous epithelium cells. As the cancer cells move into the epitheliums, there's an inflammation which brings the extracellular fluid out, breaks through and into the skin. This would then rise and form crossovers over the skin surface. The second type is called lobular carcinoma in situ, or ICIS. And that's where the cluster of tumor cells grow within the lobules, within the invading ducts, causing the affected alveoli to enlarge. Unlike DCIS, over time, LCIS doesn't cross the basement membrane to form an invasive lobular carcinoma. LCIS got its name many years ago before it was realized that it's not a breast cancer, and in the sense that it doesn't invade surrounding tissues. Just like the healthy alveolar cells, some breast cancer cells have hormone receptors that allow them to grow in the presence of the hormones. Based on the type of the hormone receptors, breast cancers can be divided into three major types. The estrogen receptors, or the ER positive, in HER2 negative carcinoma, which is the most common. HER2 positives and ER positive negative carcinoma, and ER negative and HER2 negative carcinoma. Breast cancers can cause a few complications. First, the tumor causes local inflammations, which causes the damage to the suspensory ligaments in the lactiferous ducts, resulting into their fibrosis. Next, the cancer can invade nearby tissues like the pectoral muscles below and the skin above. Cancer cells can also enter in the back and the tiny lymphatic cells within the cause of the lymph to build up in the interstitial spaces. Normally, these fluid buildups would cause the swelling, but the attachment of the suspensory ligaments doesn't allow the skin to stretch. So the skin becomes thickened and dimpled like an orange peel, called peau d'orange appearance. Finally, tumor cells can spread via the blood to the spine, brain, and bone, or the lymph nodes or other sites of the axillary lymph nodes and the other breast. In males, breast tissues are very thin, which makes it easier for the cancer to spread to underlying tissues. The first symptoms of the breast cancer is hard, painless lump or swelling, which is most commonly in the upper and outer part of the breast. Additionally, there may be a swelling under the armpit if the cancer spread to the axillary lymph nodes. The breast can become mobile and fixed or stuck into the chest wall due to the infiltrations of the cancer cells spread to the pectoral muscles. Another symptoms of dimpling of the skin over the breast due to the involvement of the skin. Fibrosis or lactiferous ducts in suspensory ligaments causes retractions or pulling into the nipples. When Paget's disease is present, it can cause itching, redness, crusting, and discharge from the nipple. Diagnosis of breast cancers usually begins by feeling of a breast lump. Breast cancers can be treated effectively when it is detected early in the course of the disease. That's why regular screening with mammography, which is an X-ray of the breast, is done in high-risk individuals. In addition, imaging using ultrasounds and MRI may be done to detect the tumor. Finally, a biopsy of the swelling or fine needle aspirations and cytology where the fluid from this following is taken may be done to confirm the diagnosis. To determine the risk of the breast cancers, each one is staged by the T and M system. T indicates the size of the tumor and whether or not it is grown in nearby areas. For example, the chest wall muscles, and describes the degree to which the cancer has spread to the nearby lymph nodes. And finally, M indicates the degree to which the cancer spread to the other sites or metastasized. Each of these categories is ranged from 0 to 4, with 4 being most severe. Finally, The combinations of these substages determine the stage group, which are assigned 0 to 4. Treatment for breast cancers is based on the type and stage of the cancer, but commonly involves surgery, radiation therapy, chemotherapy, and hormonal therapy. Localized tumors are removed surgically by a partial mastectomy, where the affected part is removed. Enlarged tumors which have spread in nearby tissues are removed by total mastectomy, where the entire breast is removed. In addition, nearby structures like lymph nodes may also be removed if the cancer has metastasized. Hormone therapy is used when the tumor cells has hormone receptors like estrogens in HER2, and may include medications which block the formations or effects of the estrogens. Alright, as a quick recap, breast cancers or breast carcinoma is the uncontrolled growth of epithelial cells lining in the ducts and lobules of the breast. Breast cancer usually begins as an C2 carcinoma, which can either be ductal carcinoma in situ or DCIS, which is localized to the ducts, or lobular carcinoma in situ, or LCIS, which is localized within the lobules. Over time, in situ carcinoma can invade basement membrane to become invasive carcinoma, involving the ducts and the lobules. Breast cancer screening by mammography is done for early detections of the cancer, which can be treated by a variety of treatment options, including surgery, radiation therapy, chemotherapy, and hormonal therapy.